My right eye seems to be a lot smaller than my left and is noticeable in pictures. What are my options?
Thank you for your question. You submitted your question with a close-up view of your eyes, and you're asking your question about the perception that your right eye appears to be considerably smaller than your left, and that you notice in particular when you take photos, and you're asking what are your options. Well, I can certainly share with you what my impression is in the absence of a full physical examination, but I think I can give you some guidance as to how I approach this type of situation in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people with their eyelids, and especially when it comes to more advanced eyelid procedures such as Asian eyelid surgery, has been a very big part of my practice. And I think that when I look at your photos, I can just give you some basic principles that are applicable that can help guide you as to what is probably the option that will fit best for you. So to begin with, this situation where what I see is in the left eye you have a crease, and the fold of skin is actually above that crease. When you look at the right eye, you don't see a crease. You see a fold overlying the eyelid margin. And this is actually a very common situation. There's a certain anatomic variation that is specific to people of Asian descent. And it has to do with the absence of a crease or the presence of a crease. And it's due to an attachment between a muscle called the levator muscle. The muscle can also sound like the word elevator or look like the word elevator and without the letter E. It's the muscle that lifts the eyelid. Well, from the front of that muscle, there are these fibers that attach to the skin. And when they're attached pretty firmly, you get a crease. When they're not attached, you don't have a crease, and the skin folds over. When the skin folds over, it creates a perception of the eye being smaller. And essentially what it is that the fold is defining the shape of the eye. And so it is, generally speaking, a relatively straightforward issue. What is the key is to try to create that connection between the skin and the muscle, the levator muscle. And that's the entire basis of Asian eyelid surgery. Now, when you learn more about Asian eyelid surgery, you learn that there are non-incisional procedures and incisional procedures. A non-incisional procedure is basically defined by essentially making small openings in the skin and attaching the skin to the muscle underlying the levator muscle and creating that fold. I would say that it's more than likely that in your situation that you would probably benefit from that procedure. Again, in the absence of a physical exam and seeing how much overlap of skin there is. But when I make this decision, I basically look between the choice of doing a non-incisional or an incisional procedure. In an incisional procedure, I'm either removing some skin or addressing a certain amount of fat in order to create that crease and that fold. And so in a situation like yours, where all I see is a little bit of folding over the skin, I could actually visualize the placement of the sutures that would result in a crease that would create some balance. Now, of course, there are pluses and minuses to every surgery and risks, etc. But I think that when you get down to why your eye is looking smaller, the right eye than the left, it is because of the fold of the skin. It's very straightforward. In fact, in our practice, what I routinely do is use something like a Q-tip to just create a crease and push the skin in a way that mimics what would happen if I were to attach the skin to the muscle with the surgery. And basically you can then see what it would look like. And like I said, the procedure itself is fairly straightforward. In our practice, we do this procedure under local anesthesia with light sedation. Because it's, especially if it's a non-incisional procedure, it's actually fairly straightforward, and it's done pretty quickly. It's done with local anesthesia. And it's just a matter of allowing the time for the skin to heal over the course of several weeks. But most people go back to work in about a week. And as far as swelling with Asian eyelid surgery, the area between the crease and the eyelid margin is an area where swelling can linger for several months, but does progressively typically get better. And it's usually a little bit less swelling, in my experience, with non-incisional compared to incisional. So I think it's probably the next appropriate step for you is to meet with qualified, experienced eyelid surgeons who have a lot of experience with Asian eyelid surgery and learn about what your options are based on this particular issue of the absence of a fold resulting in overlapping skin. And of course, a proper examination will reveal any other issues that would potentially be useful to address at the time. But again, as I said, my impression is that this is basically a matter of getting that skin to fold in so that it matches as closely as possible the other eye. So I hope that was helpful. I wish you the best of luck. Thank you for your question.